Did you know the medications you're taking daily could be silently increasing your risk of heart attack or stroke? Yes, while these meds might be helping you manage pain, allergies, or other conditions, they could be doing some sneaky damage to your heart over time. But don't panic just yet. In this video, we'll dive into 6 common drugs that might jeopardize your cardiovascular health, and we'll give you the tools to make more informed decisions about your health and well-being. Let's talk heart health. Number 5. Hormonal contraceptives. Love for family planning, not so much for the heart. Hormonal contraceptives have been a game changer for women, providing more control over family planning than a remote control on a lazy Sunday afternoon. But like that feeling you get when you realize your pizza has pineapple, what? There's a catch. These contraceptives, particularly combined hormonal contraceptives, can increase the risk of heart attacks and strokes. Research has shown that women who use contraceptives, especially those containing both estrogen and progestin, are at a higher risk of arterial events like heart attacks and ischemic strokes. Estrogen's ability to affect your blood's ability to clot is the main culprit. Studies show that women using estrogen-progestin pills have twice the risk of heart attacks or strokes compared to those not on hormonal contraceptives. And while that might sound bad enough, non-oral contraceptives like the vaginal ring could increase the risk of heart attacks by 3.8 times. That's like suddenly realizing the vending machine you thought had chips only contains kale chips. The upside? Progestin-only options like IUDs don't carry the same level of risk. So before you grab the pill bottle, consider your heart's well-being and chat with your doctor about safer options. Number 4. Non-steroidal anti-inflammatory drugs. Painkillers that could come back to bite. Non-steroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are like the superheroes of the painkiller world. They step in when you've overdone it at the gym, twisted an ankle, or simply need relief from the horrors of a headache. However, just like your favorite superhero with a dark secret, we're looking at you, Bruce Wayne. Non-steroidal anti-inflammatory drugs have some hidden flaws. These meds work by inhibiting COX enzymes, which reduce inflammation and pain. But this also messes with your blood flow and can increase the chances of clotting. The issue is that non-steroidal anti-inflammatory drugs disrupt the delicate balance between blood vessels constricting and dilating, making it easier for your blood to clot. And as we know, blood clots can be a big deal if you've got heart conditions. The FDA has warned that even the first few weeks of non-steroidal anti-inflammatory drugs use can increase your risk of heart attack or stroke, and long-term or high-dose use only makes it worse. To make matters worse, diclofenac, often found in over-the-counter meds, has been linked to a higher risk of cardiovascular events than other non-steroidal anti-inflammatory drugs. So next time you're reaching for that bottle of ibuprofen, think about how long you've been using it, and if it's time to talk to your doctor about alternatives. Who knew your painkiller could be a secret villain? Number 3. Thiazolidinediones, diabetes drugs that could make your heart skip a beat. For people with type 2 diabetes, thiazolidinediones like rosiglitazone have been lifesavers in controlling blood sugar. But these meds aren't just lowering your glucose, they might be silently playing with your heart health too. These drugs work by improving insulin sensitivity in your body, but they also affect your fluid balance and lipid metabolism, which can lead to heart-related problems. In 2007, a meta-analysis published in the New England Journal of Medicine showed that rosiglitazone users had a 43% higher chance of suffering a heart attack compared to those not taking it. Furthermore, rosiglitazone has been consistently linked to an increased risk of heart failure. Talk about an unwanted side effect. But here's the kicker. While the connection to heart failure is well established, studies on the link to strokes and overall mortality remain less clear. That doesn't mean you should stop taking it without consulting your doctor, but it does highlight why doctors are increasingly opting for alternative medications with safer cardiovascular profiles. If you're using thiazolidinediones and have heart disease, it might be time to chat with your healthcare provider about a switch. Number 2. Certain antidepressants, mood boosters with heart side effects. Antidepressants are life changers for many people struggling with depression and anxiety. Whether it's the classic tricyclic antidepressants or the more modern selective serotonin reuptake inhibitors, these medications have been instrumental in lifting moods and improving lives. However, like that one friend who's always bringing up their drama at the wrong time, antidepressants can cause some heart-related issues that might leave you scratching your head. Let's start with tricyclic antidepressants like amitriptyline. While these meds help regulate the levels of norepinephrine and serotonin in the brain, which are crucial for mood regulation, they also have an unfortunate side effect on your cardiovascular system. For instance, tricyclic antidepressants can cause a sudden drop in blood pressure when you stand up, a lovely condition known as orthostatic hypotension, making you feel dizzy or even faint, definitely not the high you want to feel from medication. And if you think that's all, brace yourself. Tricyclic antidepressants have also been linked to tachycardia, rapid heart rate, and arrhythmias, irregular heart rhythms, which could lead to more severe conditions like heart failure. As if that wasn't enough of a buzzkill, tricyclic antidepressants can also interfere with the conduction of electrical signals in the heart, as seen in ECG results, by prolonging heart intervals like the PAR, QRS, and TT intervals. This can put you at risk of developing dangerous arrhythmias. But hey, don't throw your antidepressants out just yet. Selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, are typically a safer alternative for people who need mood support. Selective serotonin reuptake inhibitors are less likely to cause severe heart issues, but even these seemingly gentler meds aren't without risk. For example, some selective serotonin reuptake inhibitors like citalopram can cause dose-dependent heart rhythm problems, including torsades de pointes, a rare but potentially life-threatening condition that can lead to sudden death. Yes, that's as scary as it sounds. Number 1. Pseudoephedrine, the decongestant that can leave your heart racing. Ah, the cold season, when you turn to your trusty decongestant to relieve that blocked nose. Pseudoephedrine, found in many over-the-counter cold meds, is the usual suspect. While it works wonders for clearing up your sinuses, it can also send your heart into overdrive. Pseudoephedrine works by stimulating alpha-adrenergic receptors, which cause blood vessels in the nose to constrict, reducing swelling. Unfortunately, this vasoconstriction isn't limited to just your nasal passages. It can affect blood vessels throughout your body, including those in your heart. As a result, pseudoephedrine can elevate both your blood pressure and heart rate. In fact, research has shown that for people with controlled hypertension, pseudoephedrine can still cause a noticeable increase in systolic blood pressure. In some cases, there have been reports of pseudoephedrine triggering acute coronary events like heart attacks. This is especially dangerous for individuals with existing heart problems, as the vasoconstriction can increase the heart's oxygen demand and lead to dangerous events. So if you have heart disease or hypertension, check with your doctor before using decongestants containing pseudoephedrine. Your nose might be cleared, but your heart may not be as thrilled. If you found this video helpful, make sure to give it a thumbs up. Your support helps us keep bringing you more valuable health tips and insights. Got thoughts, questions, or maybe a medication you're curious about? Drop a comment below. We love hearing from you. Don't forget to hit that subscribe button and turn on the notification bell so you never miss out on our latest videos. We're here to keep you informed, entertained, and most importantly, healthy.